Hello, and welcome to the Saline Weight Loss Center. We're so glad that you're here to learn about weight loss surgery. I'm Judy Garrett, and I'm the bariatric coordinator here at Saline Health System. That means if you have any questions at all, I'm here to help. I'll be here every step of the way in your weight loss journey to ensure you have the best care. I first want to introduce you to our weight loss team. As part of our program, we have three wonderful surgeons, Dr. Kristen Patton, Dr. Rex Luttrell, and Dr. Lewis Porter. In addition to our weight loss surgeons, we also have a whole team to care for you, including a dietitian, cardiac doctor, sleep study physician, psychologist, nurses, and more. Actually, as part of our commitment to your weight loss, we've trained every staff member at our hospital on how to care for our bariatric patients. We are even one of the only bariatric accredited facilities in the state. That means anywhere you are in the hospital, you'll be greeted by someone who has been specially trained to care for you. And as part of this accreditation, more insurance companies will cover bariatric surgery at Saline than at non-accredited facilities. Now, to get us started, we're going to have Dr. Kristen Patton tell us a little about the social and economic effects of obesity.
In the U.S., 1 in 3 adults are obese. This major health crisis has some serious effects on Americans, both socially and economically. From a social perspective, people who suffer from obesity tend to feel the effects of a social bias or discrimination. Rather than feeling sympathy or compassion, people tend to act judgmentally towards people who are obese. In addition, patients suffering from obesity also tend to suffer from other illnesses and experience premature aging. From an economic perspective, obesity has a direct impact on the U.S. healthcare system. In 2008, an estimated $147 billion was spent in medical costs for obesity. If obesity trends continue, it's estimated that related medical costs could rise an additional $43 to $66 billion each year by the year 2030.
Thank you, Dr. Patton. Let's now take a deep look into the obesity trends over the past couple of decades. Dr. Lewis Porter is going to help take us through these statistics.
Unfortunately, in the United States, obesity is a major problem that is growing. Let's take a look at some of the numbers to show you the specifics of this crisis. The first map shows the number of Americans in 1994 who suffered from obesity. This one shows the same data for 1999. As you can see, in just 5 years, we went from no states in the red to nearly half of the United States being above the 20th percentile. From there, you'll see in 2005, where nearly the entire U.S. is in the red, and 2 new categories were even added. To sum it up, you're not alone. The obesity crisis in the United States is widespread. Along with these high statistics come significant increases in mortality rate among Americans. Here are some of the facts about the relationship between obesity and mortality and morbidity in the United States. First, obesity worsens health and the quality of life and actually shortens life expectancy. A recent study concluded that obesity in adulthood is associated with a decrease in life expectancy of about 7 years in both men and women. After smoking, obesity is the second leading preventable cause of death.
Thank you, Dr. Porter, for sharing those statistics with us. Next, we're going to ask Dr. Rex Luttrell to tell us about what influences weight gain and how obesity is determined.
Weight gain and obesity are the result of a combination of influences, including the types of food you choose to eat, behavior around your eating patterns, and your metabolic rate. While food selection and eating behavior are easy to control and monitor, metabolic rate is much harder to control. However, it is affected and can be somewhat controlled by diet and exercise. Now, let's talk about what exactly morbid obesity is. Clinical morbid obesity is the point where serious medical conditions occur as a direct result of obesity. Clinically, it is diagnosed when the patient is more than 200% of their ideal body weight, is more than 100 pounds overweight, or has a body mass index greater than or equal to 40. Now, in order to determine your body mass index or your BMI, please refer to the chart on the screen. Using your height and weight, determine in which category you fall. This is important because your BMI is used to determine whether or not you qualify for bariatric surgery.
Thank you, Dr. Luttrell. Now, before we move into treatment options, I want to tell you about some other obesity-related health risks that you could be experiencing. These include diabetes, hypertension, hyperlipidemia, metabolic syndrome, heart disease, sleep apnea, PCOS, cancer, gallstones, urinary incontinence, GERD, degenerative arthritis, venous ulcers, depression, joint problems, low back pain, infertility, DVT and thromboembolisms, and asthma. Based on your BMI, if you fell into the categories of severe or morbid obesity, your risk of experiencing these serious medical problems is greatly increased. However, keep in mind, we are here to help you. We want to not only help you meet your weight loss goals, but also help you live a healthier life overall. Now, what you've all been waiting for, we're going to have our surgeons tell you about some of the treatment options we provide here at Saline Weight Loss Center.
One of the most commonly requested procedures is the non-surgical Orbera balloon. This procedure is a new incisionless, non-surgical option that gives you the momentum you need to amplify all of your weight loss efforts. The Orbera procedure places a small balloon in your stomach that fills about a third of the stomach, helping you feel fuller after eating smaller meals. The procedure takes 20 to 30 minutes, only requires a mild sedative, and allows you to go home the same day. The first week of the Orbera will be challenging. Patients should expect to feel sick for the first 3 to 5 days. In some patients, symptoms may last up to 2 weeks. Medications will be prescribed to help address the symptoms, and our support team is available to help as needed. As with all weight loss surgery, your efforts matter. Orbera provides a boost to lifestyle modification. Patients' adherence to the diet and exercise program will impact the outcomes. Success with the balloon leans heavily on the patient keeping appointments with a bariatric dietitian, surgeon appointments, and attending support groups. While Orbera does not require surgery, any medical procedure requires careful thought and consideration. To qualify Orbera, you must be an adult, have a BMI of 30 to 40, and be willing to participate in a medically supervised program.
In addition to the non-surgical Orbera balloon, we do offer surgical procedures. Let's first talk about who is a candidate for bariatric surgery. In order to qualify for surgery, one must meet certain requirements. 1, you must meet the National Institute of Health criteria for obesity. That is 100 pounds over ideal body weight, a BMI of greater than 40, or a BMI of greater than 35 with weight-associated disease. Secondly, you must be over the age of 18. Thirdly, you must have failed medically supervised weight loss attempts. Fourth, you must have acceptable operative risk as it relates to the patient and the procedure. Next, you should have no endocrine cause of your obesity. In other words, any medically treatable causes of your obesity. And 6, and most importantly, you must be dedicated to a change in your lifestyle and follow-up.
At Saline Weight Loss Center, we perform 4 surgical procedures to treat obesity. These procedures include the gastric bypass, the sleeve gastrectomy, the adjustable gastric band, which is also known as the lap band, and the overstitch procedure. Let's begin by discussing the gastric bypass. Some advantages of the gastric bypass are that it provides excellent appetite control, provides a rapid initial weight loss, helps control type 2 diabetes, and it has a higher percentage of excess weight loss than the sleeve or the gastric band. Some disadvantages of the gastric bypass are that the stomach must be cut and stapled, and intestinal rerouting is required. A portion of the digestive tract is bypassed, which may result in nutritional deficiencies and is also non-adjustable. Now let's discuss the gastric sleeve. The sleeve procedure is also done laparoscopically. About 80% of the stomach is removed, leaving a vertical tube that's about the size of a banana. Research has shown that people that have this procedure do lose more than half of their excess body weight. However, this procedure is not reversible. There are multiple risks, including a leak after surgery and a risk of poor nutrition. Patients must be committed to taking vitamins for the rest of their life. Another risk after the sleeve is that it may cause acid reflux.
The third procedure we will discuss is the laparoscopic adjustable gastric band, also known as the lap band. This procedure is statistically the safest bariatric procedure available today and has proven to provide gradual but steady weight loss. You will have multiple appointments with your physician, and he or she will be able to make adjustments to your band to make it suit you. This can be done in the office. The limitations of the gastric band are 1, more frequent adjustments, and 2, it is not quite as strong a tool for the treatment of diabetes mellitus. There are also complications specific for the lap band, including 1, an erosion rate of less than 1%, and 2, band slippage of 1 to 5%. Studies have shown that people can lose weight as successfully with the gastric band as they do with other weight loss surgery.
The final procedure we will discuss is the overstitch. The overstitch is a unique procedure because it's designed for patients who have had a weight loss procedure in the past, but have experienced complications that cause them to either not lose weight in the first place or gain back the weight. The pros of doing the overstitch for weight gain are that it is done endoscopically and therefore much safer than having a second surgical procedure. Because the procedure is new, there are currently no long-term studies.
As you can see, we have a variety of options for patients needing to lose weight. However, regardless of the procedure you choose, we provide the follow-up care you need to successfully meet your goals. Follow-up care for procedures includes a nutritionist to create a diet plan that's right for you, regular exercise as advised by a physician, behavioral counseling and therapy as needed for weight regain, and follow-up appointments with a physician, which is specifically important for band patients who may need adjustments. It's important to keep in mind that any surgical procedure can result in disappointing results depending on multiple factors. But the most important thing we want you to understand is that weight loss surgery is a tool, not a fix. We are here to help you use your tool in the most effective manner in order to achieve your goals. In addition to our surgical weight loss procedures, we also offer a non-surgical option that could be right for you. Now, if you're ready to get started towards a healthier, happier you and join our team of weight loss warriors, we're ready to help you. To start, contact us at 501-574-7171 to schedule an appointment for consultation. Before that appointment, you will need to request records and a letter of recommendation from your primary care physician. If you have any questions at all, give us a call at 501-574-7171 or find us online at salineweightloss.org. We look forward to hearing from you.